Good morning. Today we'll talk about tropical sprue. Before that, what is these? These are called villi. Villi are not cells, first of all, these are structure, okay? And they are present where? Small intestine, duodenum, jejunum, ileum, mainly in jejunum, okay? You can see that. What are these called? Villi. If you will zoom into these villi, inside them, what you will find, there are some arteries and then there are some lacteals, right? Okay, villi are what? They are very tall, okay? Because they are tall, they help in absorption. And if you will zoom on the surface, their surface is not plain. They have some cell on the surface. These villi have enterocytes, and those enterocytes have some small, line-like structure that are called microvilli. So if you will zoom into these arteries, this artery helps in absorption of sugar and amino acid. Now the question is how it happens, right? Second, before going to that, we will see these, as I said, these are very tall. If they are tall, they will have long surface area, help in absorption, right? Long surface area. Now, see these arteries. As I said, these arteries will help in absorption of what? Sugar and amino acid. How? These arteries have some free-floating enzymes, right? What are those enzymes? Lactase, sucrase, maltase, peptidase. Lactase, by the name it is clear, it will help in absorption of what? Lactose. It will break down lactose into glucose and absorbs it. Sucrase will absorb glucose and fructose. How? It will break down sucrose into fructose, right? And so it will break down sucrose into fructose and glucose. Maltase will break down maltase into glucose, and peptidase will break down peptides, that is into amino acid, means help in absorption of sugar and protein. Lacteals will help in absorption of fat, okay? So all sorted. So these villi are helping absorption of sugar, fat and protein, right? Now let's talk a little bit about these cells that we were seeing. Enterocytes. What are these enterocytes? Enterocytes are nothing, it is type of a epithelial cell, okay? What are epithelial cells? These are the cells that line surface and cavities, right? For example, intestine, they have different names according to their different function. For example, if they secrete epithelial cell that secretes mucus are called goblet cells. Enterocytes that help in absorption are called what? Enterocytes, right? So enterocytes is nothing, it is a type of epithelial cell that are present on the surface of these villi, and it have microvilli, and it help in absorption of what, doctor? Fat, protein and carbohydrate, right? So far so good, right? Help in absorption of sugar, fat, carbo and protein, right? So these are tall, so it have more surface area, absorb everything well, right? What will happen if they are not so tall? Absorption will decrease, right? Great. So now it will go and talk about the tropical sprue, what was happening. So a small intestine normally have not so much of bacteria. Imagine a person who is living in a tropical region, have poor hygiene, and he gets bacterial infection again and again, okay? So what happens because of this recurrent bacterial infection? Now a lot of bacteria is under in the small intestine. Normally small intestine have low bacterial load, right? Now these bacteria will come from where? For example, a person weak immunity, poor sanitation, right, will develop diarrhea a lot of time and have a lot of bacteria because of these things, because of ongoing infection, a lot of infection because immunity is low, right? What bacteria produces? It produces enterotoxin. What is enterotoxin? Enterocytes. Okay, it will attack enterocyte. That is what? A type of epithelial cell that is present on the surface of villi, help in absorption. So now what the enterocyte did? It will kill these, enterotoxin will kill these enterocytes, right? Bacteria releases enterotoxin, kills these enterocytes, right? Now, but the good thing about enterocyte is when one enterocyte dies, another replaces it, okay? Another will come within 2 to 4 days, okay? But bacteria also releases these inflammatory mediators. Now what the inflammatory mediators do is, for example, cytokine, it will not let that happen. Enterocyte will inhibit enterocyte maturation. A new enterocyte dies on the surface, fall off, new was supposed to come from inside. Now these inflammatory mediators will not let that happen. Okay, so what is this whole process called when the new enterocyte is coming and replacing the old enterocyte? That is called enterocyte turnover time. So that is also hindered. So because of all this function, what happened of all this infection, now villas are not that tall, they are short, that are called blunted. Because they are now short, they have less surface area, so less absorption, right? Now arteries are also very small, so less enzyme will come, right? All those enzymes, sucrase, maltase, right, peptidase. So what happens? It was absorbing what, doctor? Sugar is coming from where? Carbohydrate is less absorbed. Now the problem with the carbohydrates are osmotically active. Whenever they are in the lumen, they will pull lot of water. So now there is lot of water inside those lumen. Patient will develop diarrhea with lot of water. What is that diarrhea called? Watery diarrhea or osmotic diarrhea, right? Fat is now also not absorbed much, right? It was lacteals was helping absorption of fat. See, arteries, lacteals was absorbing fat. Now villas are short, so absorption of fat is also less. There is lot of fat in lumen which will come out through your feces. Now your feces have lot of fat. Now what will be the character of feces? It will be pale, gray and foul smelling, right? What I said, these villi are present into duodenum, ileum. Duodenum help in absorption of what, doctor? Folic acid. With help of what? These villi. Now duodenum is damaged, means these villi are short, less absorption, right? Less absorption of folic acid. Folic acid was required for DNA synthesis of what? Enterocytes. So enterocytes are not big, new enterocytes are not formed, right? So how we will treat these patients? First give them folic acid. Okay, now what happens when you give them folic acid? Now the new enterocyte can take place of these damaged enterocytes, so their symptom will resolve quickly, because now it will become tall again within 2 weeks. You know, they are asymptomatic, their symptom improves, but you have to continue it for 3 to 6 months. Okay, folic acid. Again, it will also affect ileum, because I said, right, villi are present in duodenum, and ileum. Ileum absorb vitamin B12. They have macrocytic anemia plus neuropathy. Give them 100 microgram vitamin B12 IM. Why IM? Still, you know, villi are still damaged, right, in the beginning. So if you give tablet, there will be less absorption. Give them IM injection for 6 weeks weekly, okay, and then monthly for 6 months, right? So that was about it. But what was the core problem? You resolved symptom. Core problem was bacterial infection. Give them tetracycline 250 mg QID for 3 to 6 months. Why 3 to 6 months? Chronic infection. Why only tetracycline? Broad spectrum, will kill gram positive, gram negative, atypical, act specially on intestine and also have anti-inflammatory effect, right? What was happening? Bacteria was releasing enterotoxin. That was also inflammatory mediators. Inflammatory mediators was killing the enterocyte. So when you give them tetracycline or doxycycline, you are not only just killing bacteria, you are already also killing the already present inflammatory mediators. Okay, so now in short,